With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.
I want to thank you for inviting me to come and speak today. I also want to thank you for your support. A children's hospital like this doesn't happen without a support of a great community, and I think Baton Rouge should be very, very proud. I do want to accomplish three things today. I do want to talk about the Children's Hospital and some of what we're doing for children's health in Baton Rouge. I also want to talk about FMOL, the health system, and what we're doing across the state to improve pediatric care, and also in specific some things that maybe we can look for on the horizon, or some challenges that maybe we may be facing in Louisiana from a children's health point of view. Franciscan Missionary of Our Lady, they've been in Louisiana for over 108 years. In Baton Rouge, their ministry, their healthcare ministry, started out in 1923 with the original Our Lady of the Lake Hospital down by the lakes. In 1945, Sister Julie O'Donovan dedicated a specific portion of that hospital to the care of children. In 1978, we moved to the campus on Essen Lane, and Our Lady of the Lake Regional Medical Center continued to grow. From a children's health perspective, Our Lady of the Lake Children's Hospital became a hospital within a hospital in 2004. And in 2016, we were fortunate enough to break ground on a new children's hospital. So where are we today?
What once began as an idea, a hope, a prayer, deep within the hearts of our sisters, has become real. A mission to serve, a call to heal, a vision to create a healthier tomorrow has come alive. You believed in this dream. You, our team. You, our community. You, the believers. You breathed life into this idea with thousands of hours of labor, prayers, planning, faith. Brick by brick, every inch thoughtfully designed to spark hope, laughter, inspiration, and childlike faith in a purpose greater than ourselves. From the tiniest eyes to the biggest hearts. From the helping hands to the willing feet, you were the architects of our dream, building on the foundation of our sisters' love for those most in need. You believed we could create the very best for all the children of Louisiana and beyond. And now, what once began as a dream has turned into belief. The belief that we could create a place for advanced, specialized, and personalized healthcare for our children. A place where love inspires children's laughter, that tethers us to our roots, yet paves the way for our future. You helped us build amazing. Thank you for believing in amazing. Thank you for believing in us. Our Lady of the Lake Children's Hospital in Baton Rouge.
We moved into our new hospital October 5th, 2019. We had 38 patients that morning, and we moved those 38 patients in 2 hours and I think 39 minutes across the street. That's a patient every 7 minutes. We opened the hospital officially at 6 o'clock that morning. At 6:01, we got our first call for a transfer from North Oaks, a child that needed care beyond what they could provide. By 6:10, we had a walk-in into our emergency room, so we were already taking care of children coming through the doors, almost simultaneously as our first patient showed up. During that 2 hours and 39 minutes, we admitted a couple of other patients. We had our first trauma alert, so a lot of firsts happened in that first 2 hours. What you see here is our last patient that was coming in the door that day and completing our move. Phenomenal team effort. We feel like it went off very, very well. So For those of you who haven't seen the Children's Hospital, I know you got a glimpse of some of that in the video, but I do want to give you a feel for what it is. We opened with 82 beds, 42 medical surgical beds, 30 pediatric intensive care beds, and 10 St. Jude's Cancer Center beds. The St. Jude's cancer beds, they're all on one floor. It's a unique design. You have inpatient beds, a clinic, and an infusion center all on a single floor, so a child with cancer just has to go to one floor. We do have the capability to grow very quickly. The sixth floor is shelved. We can expand into that, another 40 beds fairly quickly, and the hospital itself can hold 2 more floors. We do anticipate we're going to need to utilize that space. Since moving in, our volumes have been very robust, even above what we would think about as the winter season. We are starting on a 10-bed NICU that we hope to open in the summer, and we're going to be adding 6 more beds to the St. Jude's floor, the 3rd floor, to give us a little more capacity. We have 5 operating rooms. 1 room is shelved. It's meant to be kind of a cath lab hybrid operating room for expansion in the future. Some neat features about our hospital: we have a playroom and family amenities on each floor. We take care of kids from across the state, and these are very important to us to be able to provide a healing environment. We have a new family resource center, so families, when they have a new diagnosis of diabetes or something even more rare, they can go and they can get support. They can find out what type of support may be in the community or research a disease process. Full imaging and lab capabilities. This is a standalone hospital, freestanding hospital, and we do have a mission for education. We've had a pediatric residency program for about a decade. We have 12 pediatric residents a year, so we have a conference center and a GME lecture hall to be able to provide for that mission. We do feel like this is Louisiana's Children's Hospital. Since we opened, we looked a couple of weeks ago at the zip codes of patients we've admitted, and we've taken care of children from 57 of the 64 parishes since October. So literally and figuratively, we feel like we're Louisiana's Children's Hospital. The figurative portion comes in that our interior design is designed around the ecosystems of Louisiana. So the 1st floor is the Mississippi River theme. The emergency room is the bayous. The 5th floor, our med-surg unit, is the piney woods. And each one of these floors has animal ambassadors as well to make it a kid-friendly environment. This is the entrance to our hospital. You can see the colored panels. That's a structure we refer to as the Janopy. It's a canopy designed by Christopher Janney. It has musical elements and a little quiz in it as kids can touch the posts as they come in that releases different sounds. It sets the tone as you come in the hospital. The waves on the floor, that's an extension of the Mississippi River. That kind of flows throughout the 1st floor of our hospital. This is the entrance to the emergency room. Again, this is the bayous. The animal ambassadors for this are the alligator and the bullfrog. We intend, as we move around the system and construct different pediatric facilities around the system, we intend to take some of these themes. So the bayou is going to Women's and Children's Hospital in Lafayette. So that team actually named the bullfrog. They named the bullfrog Louie. And I have it on good authority that the alligator's name is Gracie, okay? Very personalized care. This is the 5th floor, the Piney Woods, and I mentioned to you a playroom on every floor. This looks into our largest playroom, and this is huge for our children to be able to have some sort of normalcy and promote a healing environment where they can do the things that in some hospitals they just don't get the opportunity to do. This is a pediatric intensive care room, and it actually seems smaller than it is. The rooms are very, very generous. The reason I wanted to show you a pediatric intensive care room is that when we were a children's hospital within a hospital, it was a ward system. So you had curtains in between the different beds. And these are the sickest kids that we take care of. Now each one of these children has their own room. Their family can stay in that room with them. There is a couch. We're very purposeful in the design of these rooms. There's a family zone, a patient zone, and a nursing zone. This is a big leap of care for our children in Baton Rouge and beyond. So what has happened, I told you, we've been busy since we moved in. What you can kind of see on the side, and I apologize that the numbers are pretty small, but I think you get the trends. The red line indicates opening in October. The top grid is our pediatric intensive care. We've gone up 25 to 30% in our average daily census in the pediatric intensive care unit. Again, these are kids from all across the state that are getting the highest level care. When we look at our case mix index, the acuity has gone up. We're taking care of sicker kids in this hospital than we were across the street. Our ED visits, our physicians and PAs and nurses are doing a wonderful job. Quite literally, they're seeing 1,000 patients more a month than they were a year ago. Our hematology oncology floor, you can see the trend up there as well. We are taking care of some overflow patients on that floor. It's not all oncology, but our oncologists, and we're one of 8 St. Jude's affiliates across the country, our oncologists have taken in the Acadiana market. Now they're taking care of children with cancer in Acadiana as well. So we're seeing some volume there. Our med-surg volume is about the same, but we were very purposeful when we moved over. If you look at trends in healthcare, the trend is that acute care, hospital settings, is going to be more about intensive care, less about regular med-surg beds. So we were very intentional about upping the number of intensive care beds and keeping the other beds stable. This is a slide. I always forget to say, we also built a medical office building with this hospital. We opened the medical office building in December, and it houses exclusively pediatric subspecialists. There's no general pediatrics, no other physicians there. And it is kind of hard now to jigsaw puzzle all these subspecialists in together, because we've expanded the number of specialists that are on our staff. We see about 4,000 pediatric subspecialist visits a month, and again, our subspecialties are growing. This building too is designed to go up 2 more floors. I'm thinking that we may have to do that relatively quickly. This talks about our team of subspecialists. We have pediatric subspecialists in, I skipped one. We have pediatric subspecialists in over 25 specialties, anything from adolescent medicine to nephrology, kidneys, my personal favorite, neonatology, taking care of babies, but a broad range of subspecialists to be able to provide care here in Baton Rouge and beyond. This map shows some of our general pediatric capabilities. We take care of about 15,000 clinic visits a month, just general pediatrics, and there's about 15 sites on this map in the Baton Rouge metropolitan area. The thing I want to mention with Sue is that our healthcare centers and schools is responsible for caring for 40,000 children in the school systems. We're in about 80 schools, all the way from elementary to high school. That's about 120,000 nurse visits in the schools a year, about 13,000 clinic visits in the schools a year. We also, through an extension of healthcare centers and schools, work with athletic trainers in Ascension Parish and Denham Springs. So while we talk and think a lot about the hospital, we are pretty broadly based in the community. One thing that I find when I talk with folks a lot of times is they don't understand the breadth of Franciscan Missionaries of Our Lady Health System. We are multi-state now. We have certainly Our Lady of the Lake, which most everybody here is familiar with, but Our Lady of Lourdes, Fran U, working to provide the workforce for the healthcare in Baton Rouge moving forward, Our Lady of Angels in Bogalusa, St. Francis in Monroe, and the newest addition is St. Dominic's in Jackson, Mississippi. So a growing health system within which there's a lot of pediatric care. So Our Lady of Lake Children's Hospital is kind of the cartoon hospital in the middle, and it's the hub for our pediatric healthcare system across the state. Women's and Children's Hospital in Lafayette joined Franciscan Missionaries of Our Lady Health System in March. We have St. Francis in Monroe and Our Lady of Angels in Bogalusa that provide a good amount of pediatric care. Those are the orange boxes. The purple boxes, those are outreach clinics. So we have outreach clinics for our pediatric subspecialists all across the state. Inpatient capacity, if you look across the state, we're about 269 beds. Level 3 NICU beds, 122 NICU beds across the state. PICU beds, about 50, and about 100 pediatric beds. So a lot of inpatient capability spread across the state. If you look at our employed physicians and practitioners that are either pediatric subspecialists or general pediatricians, you're talking about across the state over 100 specialists and 60 general pediatrician physicians. But that's not all the story. In that across our 5 hospitals, we have about 180 pediatric subspecialists that provide care. Not only our employed physicians, but also our academic partners and our private partners. And here in Baton Rouge, I think this slide is actually a little bit behind. It's about 120 pediatric providers. We've seen a huge growth in the pediatric subspecialties, as you might imagine, with building a premier facility. I think we're adding 7 pediatric subspecialists between now in July, anything from nephrology to ENT. So our big vision for our pediatric system is to demonstrably improve the health of Louisiana's children. So how are we going to go about that? I mean, what are ways that we as a system can help improve the health of children? One thing that I tell all of our employees as they come to the Children's Hospital is we need to provide harm-free care. We need to be dedicated to that in the acute setting. We need to be the place where professionals can do their best work. We need to be able to draw those physicians and practitioners and nurses. We need to see the patient care experience through the eyes of families and patients. And we need to be innovative. And I think that's where this group, I'm very happy to present to be able to talk about how do we connect with the community to really provide for the health of children and not just the health care of children. So these are some of the goals that we think about when we're talking about how do we, how do we improve the health of children across the state. And again, I've mentioned some of these. It's just elevating the complexity of care and thinking about building marquee programs here in Baton Rouge so children don't have to go out of the city. Making sure that we're doing a great job of helping our healthcare providers succeed in prioritizing community relationships and innovation. So what, this is the question and answer portion of the thing. I do resident teaching, so sometimes I gotta ask questions just to wake people up. What's the leading cause of mortality in children? Very good. Accidents. Most people don't know that. They gravitate to adult type of stuff. They say heart disease, or they say, cancer and things like that. So it's accidents. So if you actually take a look at CDC data, what you can see here, and it's a fine print, but across the top is the age spectrum. So less than 1 all the way to 65 plus. Down the horizontal, the side is the rankings from top to 10 as far as the number of people that may die. So I've kind of put a red box around children, and you can see in blue is unintentional or accidental injury leading to mortality is the first cause greater than a year of age for all of our age groups. In green is actually suicide, and in red, I was surprised about this, that's homicide, okay? So violence and accidental injury, these are things that we need to be paying attention to. If you look in Louisiana, this is a map from the American Trauma Society. What you can see is the white shaded states, that's less than a quarter of the state. The children live within 30 miles of a pediatric trauma center. As of 2019, Louisiana was one of 8 states in the United States that did not have a pediatric trauma center. You may say, well, why does a pediatric trauma center matter? I mean, we have adult trauma centers, don't they do just as good a job? Well, the data is that children have lower risk of morbidity and higher survival rates if they are treated in a pediatric trauma center. So one of the first things that we did with the opening of the Children's Hospital is we attested to become a level 2 pediatric trauma. We're called a program right now. It's a 2-year process to become a center, an accreditation. So we are actively working on that, and our trauma numbers are going up. We're getting transfers from other trauma centers. What you see here is our emergency room and our transport vehicle, and you see one of our trauma rooms off to the right. This is our transport team. We transport literally hundreds of children a year from across the state, as we talked about. Transport team plays very heavily into the ability to work with EMS and learn and get out there and make sure that we get kids to our facility quickly so that they can get the best care. But we also need to think upstream. I'd much rather prevent an injury than have to treat an injury. So this is a few pictures of some of our injury prevention program, the child passenger safety component, and all children deserve to drive safely. If you see most of these kids, they are special needs children, and we have a team that focuses exclusively on making sure that they can travel safely. The other thing you need to think about is once the kids are in our hospital, how do we provide exceptional care for them? This is a program called Pick You Up. Startlingly simple concept that is in the adult world is just if you're very, very sick, the sooner you get up and move around, actually the better your outcomes are, less morbidities, and the shorter length of stay. There's a pediatric correlate to this that's run out of Johns Hopkins. Sapna Kadhari, I think is her last name. She's actually working with us. We're one of the first 10 centers in the United States to participate in this program. I love the fact that she's chasing somebody who's got IV pulse, but I also love the fact that she's thinking about injury prevention. If you look at that helmet, that's important. So just a few words about children's health. Children's hospitals and children's health care is suspect to the same pressures that any other health care facility might be suspect to, or susceptible to. The issue with children's hospitals, they're a little different in that we are a little bit more heavily reliant on government payers, and that actually means that we're more heavily reliant on philanthropy as well. I talked about all those subspecialists that are coming to work with us. Actually, pediatrics has a bigger healthcare shortage than does the adult specialty, so we're facing uphill battle there too. And the other thing that I think is especially profound is the social determinants of health in kids. I was reading this morning, it's U.S. News and World Report time, so a lot of centers are sending out information talking about their research, and one of the centers sent me a notice talking about maternal stress and the effects on the fetal brain architecture. So you're thinking about social determinants of health all the way into pregnancy, not to mention poverty, food insecurity, all of those types of things that make it very challenging to improve the health of kids in Louisiana. So some environmental forces that we are thinking about. Actually, there's about 1.1 million children in Louisiana, and the projection for that is it's going to remain flat. The birth rate is actually down. We are seeing an increase in children with chronic conditions, but we don't expect that the volume of children themselves are going to go up in the short term. Dependence on Medicaid, there are, I think, 700,000+ children on Medicaid in Louisiana. There's 1.4 million people on Medicaid in Louisiana. Children make up the bulk of that. Children's hospitals in general tend to take a much higher proportion of Medicaid. What all this means is that there's a much more direct line between policy and Medicaid provision to the health of children. So it's very important when we think about how we engineer our policies to take care of kids. But these types of things have caused us to think about how we take care of children in general. There's a shift more towards value in healthcare, so a higher quality with lower costs. We also see patients, they want more immediate access. They want, a better experience. So those are other things that we need to be able to keep account of so that we can do a good job of taking care of our families. And as a community, you guys should expect, we should all expect in Louisiana, that our outcomes will be the best. Okay, I think we do need to think about how we change up the model of healthcare and how children's hospitals participate in that model. This is a little diagram here, and the reason I like this diagram is that children's hospitals are at the center, okay? The reason I like that is I think that we should be a coordinator for a lot of the activities that go on with people who are interested in community organizations who are interested in improving the health and lives of kids. We should be able to help facilitate and make those communications. I mentioned to you our work in the schools. There's a huge opportunity there for us to impact the lives of kids. Food pharmacies, we participate in the USDA summer feeding program to reduce the risk that a child may be exposed to food insecurity. I think we all are very, very worried about Louisiana being at the bottom of all the good lists and at the top of all the bad lists. But we believe, from an Our Lady Lake Children's Health perspective, that we are not going to break that cycle until we improve the care of kids.
If you believe in me, I'll be the first one in Australia to graduate college.
I'll be the one to change our history of diabetes.
I'll live a healthy life.
He really is quite good at this. And this is a sneak preview. This is our new kind of mantra, our new tagline as we go across the state. It's believe in me. We believe in our kids, and we believe we can make a big difference in healthcare by improving the care of kids.
If you believe in me, I'll be the first one in Australia to graduate college.
I'll be the one to change our history of diabetes.
I'll live a healthy life.
If you believe in me, I'll know my worth is more than face value.
I'll be stronger than a weak heart. I'll know 68 pounds carries weight in this world.
If you believe in me,
I'll believe in myself.
Belief in our children can change their future. Our Lady of the Lake Children's Health.
So, we hope that you'll see more of that, and we hope that you'll see that we take that tagline very seriously, and we will demonstrably improve the care of kids across Louisiana. But one thing we do need to do is we need to make sure you're healthy too, okay? And I've seen what you guys have been eating, all right? So I'm gonna tell you, I think it's 2 weeks from now, March 7th, is the amazing half marathon. There's a 5K, there's even a 1 mile fun run, okay? Plenty of time to train and be ready for that. We'd love to see you out there to set an example for our kids. So with that, I'd be happy to answer any questions y'all have.
What's the relationship between the Children's Hospital and St. Jude, and is there money that goes back and forth? What is it? What is it?
There is a support that is kind of co-managed, but the key thing for us is that we have access to St. Jude's protocols. The standard of care for taking care of children with cancer is they should all be on some sort of research protocol. And the reason I say research is not that we're experimenting. It's that we're getting children novel drugs when they need it. We're testing to see if we can give lower and lower doses of chemotherapy and still get the best outcome. So the advantage for us in the relationship with St. Jude's is access to that kind of science. Our physicians work extremely closely with the physicians in Memphis, and if there is a child that we see that we think, well, this is pretty rare and this is something that really we should send to the doc who sees all of these kids in the United States, this particular tumor, then we have that capability. And there is some support that helps with that relationship. Yeah.
Dr. Dunbar, your science and infrastructure is impressive. What I'm wondering, unlike myself, you're dealing with children who are innocent and sweet.
Very true.
At our age, we expect friends to be sick and deal with this, but with children, we're always, it hits us harder, and particularly with children who have serious illness. What do you do with your training to keep your staff emotionally able to deal with this every day? Most of us don't have the courage or the ability to deal with this type of stuff as you do 24 hours a day.
Yeah, well, I mean, I've reflected on this a number of times, especially when I go and I do rounds and I talk to the individuals who provide care to our kids, and it's a special breed of people, okay? So I think you need to be able to provide the structure around them so that they feel like and they know that the things that they are doing matter, okay? I think that they need to be able to have that connection with the families and the children, even if the outcome is bad. And we do provide the ability for respite for our staff. There are certain trainings that they can go through so that they are better suited to deal with some of the trauma that they see. And that may be trauma that's a pediatric death, or it may be trauma that you see quite literally in the emergency room, with children who are exposed to things that are almost unspeakable.
With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.